So good morning, everyone, and happy Friday. I hope everyone's had a great week. I'm just happy to see all of your faces. I do miss seeing you weekly. But, just because we're not meeting weekly doesn't mean that we're not working just as hard as we were working when we were meeting weekly. So I'll just go ahead and get us kicked off because, as usual, we do have a full agenda. So we'll start off with our normal updates from Mayor Schul and Chair Jacobs.
Shall I go first, Wendy, or would you like to? Okay. I just have a few updates. Good morning, everybody. It's great to see you all. Hope everybody's doing okay. And it's we continue to move ahead even through difficulties. So want to, again, always appreciate all of you all for that. A couple of updates I want to give. One is about Halloween. You all know that the city issued some Halloween guidance that the county and Durham Public Schools are also going to be widely sharing. And this guidance is that the basic message is Halloween is going to be different this year. Halloween is still going to be celebrated. We're still looking forward to people in their kids having their costumes and carving pumpkins, either at home or maybe outside, socially distanced with friends. We're encouraging trick-or-treating that is with small groups that's been prearranged with other friends. And we want those kinds of activities continue online, virtual costume contests, all those kinds of things. And Durham Parks and Rec has some really great touchless, COVID-safe Halloween activities in our parks. And all of that is you can read that on dprplaymore.org. Amber has done a wonderful FAQ on this, which is on the city website and that the county and DPS will be sharing as well. And I want to thank Amber for that. We aren't going to be having traditional trick-or-treating, though. All the big neighborhoods, all the neighborhoods that have big numbers of trick-or-treaters I've met with them. They're really trying to discourage that and encouraging people in those neighborhoods, especially, to turn their lights off so that we won't have the big crowds that gather. The other thing that we'd like people to do differently, a lot of churches and other groups have what are called trunk or treats. And those are where people gather in parking lots and move around from car to car. We're still encouraging drive-through trunk or treats, but not the regular kind, which we've had where people are gathering in person in large groups. But if churches want to do or other groups want to do drive-through trunk or treat, we think that would be great as long as the numbers aren't too big. And the Durham Parks and Rec's guidelines on that, I think, are really good in terms of what they're doing for their events. So we want a safe Halloween. We want a fun Halloween. And I think we can have both. And next year we'll be back to normal. But this year we've still got to take these precautions. We really don't want Halloween to become a super spreader event. That's super important for all of us. And I know that we all share that goal. I also want to talk about the fact that the city has raised parking rates in our lots and in our decks. And we have heard from downtown businesses, they're concerned about this. And this was done by the council on a kind of regular schedule. We have an enormous parking fee hole to fill. And this is also part of our strategy to guide, not only to not burden the taxpayers with people parking, but also to guide parking and to encourage people to come downtown by other means. So I think in general, it's absolutely the right policy. But at this time, we've heard from some downtown businesses, from Nicole and others, that this is really problematic. And so we're going to be, we're already looking at this again to try to figure out some ways to alleviate that burden and see what we need to do about those parking fees. So the council will be looking at that, and our administration will be looking at that and trying to figure out what action we need to take. We know we need to be supporting our downtown businesses at this time and all of our businesses. The third thing I want to mention is just that I really think that we need to have a dual message now. One of our messages need to be that we're doing everything we can locally to help our businesses recover and help protect our most vulnerable and help with rental assistance. But I also think we need another message now, which is I wrote an op-ed which has been published in the Herald this morning, and you'll be able to find online at the Herald and NNO website, which is about the need for national federal COVID relief. The more I think about this, the more I realize, and after we heard last week the report from Geoff and Tony and that committee, the more I am just utterly convinced that if without federal coronavirus relief, we are facing just an economic catastrophe. Our businesses that have managed to struggle through, it's not going to get easier for them. It is going to continue to be incredibly hard for them to survive. And as you all know, we face a tremendous eviction crisis. And all week I've been contemplating the number 35, I think 36% that we heard last week of our low-wage workers are unemployed. We have got to have federal coronavirus relief. And so I want us to all be thinking about our contacts. It really depends on the U.S. Senate. So I'm going to be contacting our senators directly. I really hope that everyone will do everything they can to focus on federal coronavirus relief that helps the localities. That's my report, except for I want to mention one thing that I saw in the Duke University COVID numbers that came out yesterday. Durham continues to do well. Duke predicts that by the end, we have a little over 8,000 cases, as Rod will tell us. Duke predicts by the end of the year, we'll have about 11,000 cases. But the Duke prediction for North Carolina, I thought was pretty daunting, and I thought would be important for people to hear. The prediction at the current rate of infection for North Carolina, we have now about 225,000 cases statewide, and they're predicting that they double to more than 450,000 cases by the end of the year. And this is a much higher rate of increase than Durham's, and I think is very worrying. And I thought that was probably a number that you all had not heard and probably would not see, but I thought it was important to think about. So those are my updates, and I'll pass the baton to Wendy.
Thank you, Steve, and good morning, everybody. Good to be with everyone. I just want to echo what Steve has said. I appreciate you calling the alarm officially with the column, Steve, and really raising the flag on this issue. I wholeheartedly agree and am very concerned as well. So we all need to work together on, as Steve said, making it clear that this is an urgent situation. And I appreciate the work of the task force in really making that clear. Again, our presentation on the eviction crisis that we had from DSS staff and legal aid really gave us that data, really informed us about that. And then again, the great work of the economic subcommittee. And that's what this task force is really about, which is to help bring, shine a light on the issues, help us understand what the issues are so that we are able to respond in the way that we need to. And so on a positive note, I will talk about just what's happening on the ground with the way that we are addressing some of our really critical needs. And so the EAT NC program, which the county is funding, right now we have 298 families enrolled. And this is a program that we're partnering with our local restaurants on. So it is it's one of those, I think it's a great program having a collective impact because it's, again, helping our local restaurants keep them in business and our families. And so 1,000 760 restaurant meals, family meals. So this is enough to feed a family for 4 or 5 days. That is the approach that we're using. Have happened so far just in the past. It's about 6 weeks. There have been, they prepared 8,130 school meals, 298 pantry boxes of 15 pounds each actually, I left that off my notes, but what that was, I think it was rice and grains, and then 298 pounds of produce and protein at 30 pounds each. And Durham Public Schools also is feeding over, I think it's about 1,600 families have signed up for, this is for free meals for anybody in our community under the age of 18. You do not have to be a Durham Public School family. And again, we have additional capacity in this program. So we really want to get the word out about the Durham Public Schools feeding program. They have multiple sites all over Durham where people can either get meals every day or they can have meals delivered. And again, this has a collective impact because we need we want 2,000 people to sign up as a minimum, because this keeps our nutrition workers employed who work for Durham Public Schools. I also want to mention that we are going to be signing or formally approving $2.4 million for rental assistance coming to the county through the HOPE program. This is also really important, as we know that the need is so great. And this is really just a drop in the bucket. But this is federal money that has filtered through the state and then is finally coming down to the local level. And that's also a really good program because it serves all residents, including undocumented residents. And that can help with utilities and rent. We've recently heard about the HUB funding for historically underutilized businesses has come from the state. There's now a grant program for childcare providers. So there's, what I see happening is that finally some of this federal money is getting translated into programs that are finally being rolled out at the local level. So that is, I see as a very positive thing that's happening. The Durham Public Safety Hotel, we've reached a 30-day milestone in our community, and we've had 60 returning people who have left prison who are on their way back to their different counties have now come through that hotel. And last thing I would just like to say is that today is the last day to register to vote. So everybody can really do everything they can on social media to let people know how important it is to register to vote today if they have not done so thus far. And we should all like give a thumbs up or something in our boxes. But I got my flu shot, Maticia, and posted on social media about it. So would like to see who else has done that so far. So thank you, and look forward to the conversation today.
Thank you so much for those updates, and thank you, Chair Jacobs, for the reminder about the flu shot. So if you haven't gotten your flu shot, I'm going to unofficially give you a thumbs down, and by our next meeting, you're going to have a thumbs up. So Mayor Schewel, Chair Jacobs, thanks for those updates. It's great to hear about all of the accomplishments that we've had in the Durham community as we've gone through this pandemic. But just as I hear Chair Jacobs and Mayor Schewel talk and give their updates. We've accomplished a lot, but there's still a lot of work for us to do as a community, as a task force. And I think this task force has demonstrated that we're up for the challenge. So lots of work for us to continue to do between now and when our term expires. So now I'm going to send it over to Katie to provide an update on the Education Roundtable.
Terrific, thank you. Well, good morning, everyone. Our Education Roundtable met, I guess, last week, I think it was. Had great discussion again, really just so impressed with how well our schools are doing and managing through this. And you know, really very low numbers at all of the schools. And you know, it's particularly encouraging and heartening to hear, for me to hear from the students about how they're holding each other accountable, and that they really understand the importance of all of the three W's, the social distancing, the wearing the mask, washing hands, and again, are holding each other accountable to it. Science and math has only had one positive through all of this, I believe. Durham Tech, similar. DPS, Durham Public Schools, is still on Plan C, which is the remote learning, but really working on planning for when they can get back to in-person learning or some type of hybrid. And so again, everyone's doing very well. Everyone was encouraging of each other. They shared ideas. And one of the things that we asked them to weigh in on was the plans around Halloween. And they had some good ideas about how we could work together. And I think we sent the students back to maybe more formalize some of those plans. So we'll see what may come out of that, because they had some creative ideas for how to safely create Zoom type environments for some virtual Halloween activities. Happy to have anyone else who was there add in on that. But again, very encouraging.
All righty, thank you for that, Katie. So I'll move us on to the next agenda topic. And I think Katie and Rod and Ibukun normally tag team this or triple team it. So I'm not sure who wants to go first, Katie or Rod.
I always let Katie give the hospital numbers first.
All right, this will be brief. So our 7-day average is up a little bit from the last time we met. We're at just about 42 patients, 41.85 to be exact, between Duke University Hospital and Duke Regional Hospital. That's again the 7-day average as of yesterday. 14 yesterday were required critical care, that level of care. And we're at 91.5% occupancy. So we continue to be right around that 90+%. And again, that can fluctuate day to day as well. Middle of the week is higher. Toward the weekend, we see a slight dip from that, but typically not below 90%.
Thank you, Katie. And good morning to everyone. And we thank you personally for all that you do in our fight with this pandemic. I guess my message today is vigilance. It's important for us to continue to be vigilant. And, you know, I don't know how many of you out there have been big Game of Thrones fans, but I keep hearing in my mind, winter is coming. That's all I keep hearing, winter is coming. And in that series, it just meant, it was foreboding. It just meant that, you know, we needed to be prepared. And the characters would do everything that they could to prepare for the winter. And I just feel that's a poignant theme right now. So getting your flu shots and doing the things that you need to do is important. So again, I'll be brief. My message is pretty much the same as Katie's. There's been slight increases, and that's to be expected with the change in the temperatures and the change in the weather. As of present, our 7-day moving average as of October the 5th was 34. And this is a slight increase from the average of 32 last week and 30 the previous week. And it's not really attributed to anything in particular. As Mayor Schul has indicated, across the state of North Carolina, that leveling that we saw about a month and a half ago has dissipated, and we're starting to see numbers increase. And that's just a result of the change in seasons that we're going through. And, again, it's not anything that's foreboding, the worst to come. It's just a matter of temperature change and things going on. So that's been the message that we've gotten from our state epidemiologist, Dr. Zach Moore. There's no real rhyme or reason. It's just, we are starting to see a slight increase, and that's happening across the Southeast. As of Monday, there have been 183 cases so far. So again, as mentioned, North Carolina is starting to see some increases, and Durham's trajectory is slightly increasing. Our same populations continue to hold steady with their numbers, but our Hispanic population seeing a slight uptick to 46.78% of all of our cases. We clearly know that our work will continue to go in this population. African American continue to be proportionally represented at 30.41%, and our white population in Durham continues to be relatively underrepresented at 16.37%. Again, same industries that are affected: construction, unemployed individuals, and nursing care facilities. We have seen a couple of outbreaks in particular nursing long-term care facilities, and we're thankful to the state because there is funding. As Chair Jacobs has said, the federal funds have been translated into operational activities around nursing care facilities. So we continue to work steady with the state in that regard. But nursing care facilities, females, African Americans are affected, and construction and unemployed, our Hispanic or Latinx population continues to be greatly impacted by those industries as well. As mentioned earlier, our positive percentage has increased. Right now, through our model, we have it at 4.6%. That's up from last week, which was 3.7%. Duke's model has us at 2.9%, with overall North Carolina's positive percentage rate being at 5.9, or close to 6%. So we continue to do extremely well in Durham, continue to practice those behaviors that we need. I'm also elated to report that as far as COVID's impact to daycare and school-age children continues to decrease. Last month, for the month of September, it ended up being 14.35%, with approximately 120 individuals under the age of 18 being impacted by COVID. So far in the month of October, that percentage rate for individuals under the age of 18 is 11.45%. So we continue to be encouraged by those numbers. Again, as we mentioned, flu season is upon us. To those of you who've not gotten your flu shot, please do. It is out there, it's in abundance. I personally went to CVS and was pleased to see a sign that said, veterans can get free flu shots at CVS. All they have to do is produce their veteran ID card, and that's a free shot. It was painless. I felt sorry for the lady who was serving me, because I just asked, how many have you done today? And she said, you don't want to know, but I think it was like 45 or 50. I was like, wow. So the word is out. Per the North Carolina Department of Health and Human Services, we're way ahead of where we were in 2019 when it comes to flu shots. Last but not least, I'd love to give a shout out to Mariel Beasley. She did join me on the ABC 11 news segment, Perspectives. It was a joy to be with her to talk about how Durham is doing and to promote Back on the Book. I'll turn it back over to you, Katie.
Terrific. Thank you so much. Are there any questions about the numbers?
I have one question for Rod, Katie. But before I do it, I just want to, Ryan sent me a reminder of something important, which is that he thought you all would like to know, which is that we've now distributed 60,000 face masks on Go Durham, and we've ordered 40,000 more. And so this is a really effective way to get our face masks out, and that's been great. And also Ryan has, at the request of Sheriff Burkhead, gotten face masks to the sheriff for the courthouse this week, which is also something that is really great. Rod, my question is, and really this is to you and to Phil also, I'm just wondering, how are your frontline workers doing now? Your contact tracers and your have things been able to ease up some, in the sense that you've been able to give your folks some relief from the crisis mode that we were all in originally? And I'm also interested in Phil's response to that. Just how are our folks on the front lines doing, and our healthcare workers and our public health workers?
Phil, I'll be happy to go first if you don't mind.
Sounds good. Great.
I will say that we are in what I call phase 2.0, COVID surveillance 2.0. I don't know where I get this stuff from, but for the most part, I'm proud to say that effective September 1st is when we went away from 7-day operations to 6 days. So the good book says that you should rest on Sunday. So the staff does rest on Sunday. We also are able to participate in holidays, because Labor Day was the first holiday that the public health staff was able to really enjoy their families and get some respite. We continue to really monitor our staff, and I'm pretty sure Phil can attest, we have lost some people due to a number of issues, be it they're over COVID, don't want to deal with it anymore, or they had some significant childcare issues that really required a change in scenery, if you will. Nevertheless, I couldn't be more proud of my team. They are resilient, they're fighting, they continue to fight the good fight. We were very blessed, Mayor Schul and others, to have those several weeks of respite where the numbers were really, really low. It allowed us to catch up on some regular public health work, and it also allowed us to really analyze and assess our current operations. To your point about contact tracing, I couldn't be more pleased with our contact tracing efforts. Our partnership with CCNC, with the CCTO apparatus, is fantastic. We're at the point now, Mayor Schul, where they're asking us for contacts. They're just like, we need contacts, because we have so many individuals who really need, that's what they do, they work. So I believe that we're in a much better place than when we started seeing a heavy impact of COVID in late April, early May, when we kind of had that onslaught of cases. So that's the take from public health, and we continue to work with our community partners, and we're blessed to have Pilar and Michelle Lynn and Fred Johnson and Phil Harewood and everybody who kind of convenes doing the vulnerable populations. Of course, how can I forget Katie Galbraith? Everybody who participates, we're still in it, we're still motivated, and we're still working together to try to get this thing situated, if you will. Phil, I'll turn it over to you.
Thank you, Rod. We are really blessed at Lincoln. We have a dedicated staff of professionals who are, amazing in terms of how they care for this community. So far, the challenge for us is just normal business at Lincoln. We're averaging like 13,000 patient encounters per week, and there still is pent-up demand for our services. So that has, placed some challenges on us. So we've chosen, as you know, not to take on the mass testing, because we don't want to stretch our staff any further than they already stretch. As I reported last time, we got a quick start off to the flu shot clinic that we established, but that died almost immediately after I reported to you last time because of turnover in staff. We've had some challenges around our nursing staff, or certified medical assistants in particular, and other nursing staff. So what we have to do is move staff around in order to continue to meet the demand for regular services, even as we try to ramp up for the flu season and continue to test for COVID. Our COVID test numbers dropped off significantly over the past month or so. So yesterday we had about 30 appointments, which is highly unusual. The week before that had dropped off to maybe about half that number. In terms of our testing over the last week, we only did 86 COVID tests, 15 were positive, or 17%, and 29% of the positives were Hispanic or Latinos. Only 5% were African Americans, and just like less than 1% white. So overall, we're doing really well in terms of serving the community and meeting the demand for primary and preventive healthcare services, providing a primary care medical home for patients. So when patients call in, for example, to be tested for COVID, we have them talk to one of our providers and go through an extensive questionnaire. And if they don't have a medical home, of course, we try to establish Lincoln as their medical home going forward. So just about all the patients that we test, we follow up if there's a positive, and but those numbers are not huge, but they're consistent. And recently, the demand has been lower than our capacity to handle the COVID testing. We haven't had many infections of our staff members. We had about a dozen or so, and each one of those were exposed at family events or social activities in the community. And fortunately, the symptoms developed before they returned to work at Lincoln. So we have not had any major challenges in that area. But thanks for asking. We have an amazing staff, Mr. Mayor. And yeah, our priority, of course, is taking care of that staff so they can take care of themselves and their loved ones and the wider Durham community. So thanks for asking.
Thank you both. And I'll add from the health system, similarly, I couldn't be more proud of the team and just the incredible care that they provide to our patients, to their loved ones, and really starting with the way they care for each other every day. They have been extraordinary through this. We are 24/7, and we are always a 24/7 business, but I would say that the intensity, the intensity is not what it was in sort of March, April. The intensity is still there. And so one of the things that keeps me up at night is concern over that resilience, because healthcare is a very stressful field. Pre-COVID it was, and that I believe has just been exacerbated by this. And so I'm really excited that Ann Oshel is going to be with us shortly to share, what's happening in the behavioral health world, because I really do believe that we're looking at a crisis that started with the immediate public health crisis, is followed by that economic crisis, and long term will be a behavioral health crisis. So we are doing well. The team is absolutely dedicated and committed, but I do worry about that. So
can I jump in 1 second, Katie?
Please.
Thank you. I'm really glad that we just had that conversation and heard from all of you, Phil and Rod and Katie, about that. It's really important to just reflect on our frontline health workers. I'm actually married to a Duke primary care doctor, so I live that every day, and my husband rotates through the COVID clinic as well. So it is very personal to me, and I'm really glad that we've had, at least Rod, that you mentioned, and Phil, the little bit of a lull for people to get a little bit of a break before possibly, as you talked about, winter coming, Rod. So yeah, it's so important for us to. I've been thinking a lot about that as we've kind of hit the 6-month mark, and how and especially what we heard, last week from you, Anthony, and Geoff, and everyone, that just what we're looking at and for the long term sustaining ourselves. So thank you for that conversation, and I guess it will be good to hear from you all moving forward about what are the things that we need to do to support our workers as well. And so to keep that front and center, I think, in our conversations. So one thing I wanted to ask was the seeing a little bit of increase with the Latinx numbers. Wondering, do we know when the community health ambassador program may get going, thinking about things that may help us address some of the issues, because those might be things that help support you all, right? Keeping the numbers down and all that. And also, do we know how the COVID support program is going? Has anybody seen that rolling out, which of course pays the relief wages and helps people not spread it to their families and things like that? Just wondering if anyone knows about how that's working.
Good morning, everybody. I can give you the perspective from El Centro because we are one of the vendors for that group for food. I think it was a little hard to start the program because putting everything in place, and mainly the referrals and working with the NC Care 360, the barriers we were finding with some language and some the attestation we have to do with people. But I think now is working. At least we've been delivering food for a lot of community members. I think still not, and I think Michelle and Fred are doing a great job trying to let everybody know really how the program works, because there's a lot of confusion with the program and the referrals, I think. But I think now it's really up and running. What I'm a little concerned, so that support program, I think, is helping a lot. I know we talk about this, and I'm sorry, the meeting for the vulnerable population, but I think we talk a lot about mobile testing, and I know we decided not to do it, but I think if we can tie this with some of these other programs we are doing with the support services and also the community health workers and distributing food, if we can do some mobile testing attached to some of these other events. So it's not, the community doesn't feel targeted, but it's another service we are bringing on top of, let's say, distributing food. Because I think that's some issues. We are seeing people not wanting to get tested. So, and the other part, and I don't know if it's related with this, but I think the other thing that the mayor talked at the beginning, we are worried about is we are getting a lot of referrals at El Centro to help with rent and utilities assistance, and we don't have more money right now, but it is incredible. We have like 100 a week referrals that we can't help. And I don't think I would like to, and I will do the homework to investigate more how the social services assistance is doing, because we get also a lot of people having issues with the application. So, but to see how we can help, because it's really, really overwhelming. So I think it's good the work we are doing, referring people, but really there are no resources to support the community. So at the end, we get overwhelmed with people who really are not getting the help they need.
Thank you for that, Pilar.
I'll also add, Madam Chair and members of the task force, that Michelle Lynn did say that similar to what Pilar said, they did have some difficulties getting up and running, but she did say that they are up and running. They have received maybe a couple of hundred referrals, and she indicated as far as resources that were requested, at first it was the food boxes for COVID support. But that has quickly turned into relief payments for rental assistance and everything. That's now number one. But it is off the ground. It is up and running. And one of my staff also pointed to me that the ambassador program that we are funding and everything is advertising for positions as well. As a matter of fact, he forwarded the advertisement to me as well. I was a little confused. I was like, nah, that's Durham County situation. So I do believe that help is on the way. I'd also like to mention that the state did provide, and I know we're a little behind schedule, I'll be brief. The state did provide additional testing surge capacity resources to Durham County, and that is not in abundance. However, we did partner with Durham Housing Authority to be able to test 4 sites. And that should come online October 14th through the 30th, Monday through Friday, during regular business hours. We're also trying our best to work with Reverend Vergara at Ashbury United Methodist Church and the La Semille, I apologize if I'm saying it wrong, organization. But I know that they do things on a kind of cyclical basis, and we are petitioning the state to be able to have testing going on while they do the food delivery and the food distribution. So it's a lot of great things going on. As mentioned, Mayor Schul and Chair Jacobs, we do anticipate the numbers going up because, again, whenever you do some widespread testing, then that's when you find out what's really happening. But that's a good thing because that lets us know where the infections are and gives us an opportunity to contact trace and bring the numbers down. Thank y'all so much.
Thank you.
Thank you. Let's move on to just an update from last week around the economic recovery team. And I don't know, Geoff or Anthony, if you've got any additional information that you wanted to share or
yeah.
Any information you need from us.
So I think first off, thanks to the co-chairs for carving out a full extra meeting for us to discuss the important topic of what both a short-term economic recovery could look like, and then ultimately sort of what it looks like from a long-term gain. We wanted to give you guys just sort of an opportunity, since we did take that full hour last week. We wanted to at least provide you all the opportunity to ask some questions. I don't know that we fully were able to get the chance to hear back from the group regarding on what we presented. So we wanted to carve out a little bit of time at today's meeting for me to provide a general overview, kick it over to Dr. Nelson to remind you all of what the KPIs we're looking at, and then kick it over to Susan Amey talking about some specific programmings, which I know that we'll hear a little bit more detail on later on in the agenda today. I do want you all to know that we did have a chance, the group had a chance to meet on Wednesday again. And one of the things that we're looking at is sort of to steal a phrase, some of the phrasing from Rod, looking at sort of this a dashboard when it comes to reporting out on these KPIs. So without the extensive detail that we dove in on last week, we want to be able to give you guys, as we get new numbers, a quick refresher, so we'll be able to report out on those. And so our team has been working on sort of refining what that looks like for you all. As a brief refresher, the group has really been focused on aligning economic development efforts from both the public and private sector. We're doing in such a way to make sure that we continue to expand our recruitment and attraction, offering up new jobs to the community, and then making sure that we're appropriately training our residents to be able to participate equitably in these new opportunities. We're looking at fortifying and expanding support programs for small businesses. You heard from the group last week specifically about how they're being able to extend some of their support and counseling services to help folks in small business resiliency. We're looking to ensure that all programs and initiatives are inclusive and equitable. And so that is an undercurrent of every single program that we're laying out, is to make sure that as we try to rebuild, that we're doing in such a way that is equitable for the entire Durham community. We're looking at supporting and encouraging innovative talent development. You all heard from the new president at Durham Tech and some of the back to work initiatives. It's something that we're continuing to work on as far as aligning new industries that are coming to town, new industries that are looking to expand, and making sure that our community college, our workforce development board, and DPS are appropriately prepared to offer the appropriate levels of training. We're looking to promote resident and visitor re-engagement, as well as tracking key performance indicators and continuing to monitor from a market analysis standpoint what that looks like. With that, that's what we talked about in a nutshell last week in an hour, so I gave that to you in 3 minutes. I'll kick it over to Dr. Nelson. Give us a quick refresher, if you would, sir, on the KPIs that we're looking at, and then we'll kick it over to Susan, and then we'll turn it over to you all for questions. But I want to be very, very mindful of our time. You all were generous and gave us 60 minutes last week, so I just want to make sure that you have the opportunity to hear from you all too. So thank you.
Thanks, Geoff.
Well, I'll be even briefer. Overall, we looked at the KPIs, the consumer spending, the consumer confidence. We also looked at business strength and the employment numbers, as well as the overall economic numbers as it pertains to salaries. But if you look at the overall picture, it's basically saying that the economy is better than it was in March and April when we were at the height of the pandemic. But at this point in time, we're not quite back where we were in January. So overall, we're doing better, but not as good as we were at the beginning of the year.
Great, thank you. Are there questions? I know it was a lot of, first of all, it was a phenomenal presentation last week. There was so much information, but it was a lot to absorb. So we did want to have this time today for, now that we've had a full week to sort of reflect on that information and the data that was shared. Are there questions?
I have a quick question, and I agree, it was a lot of great information and certainly opened my eyes to some things that I didn't know. As you think about the KPIs that were shared, what's your suggested frequency for reporting those KPIs at the task force meetings? And if it's something you want to think about, that's fine, but just want to kind of understand that because I wasn't certain.
So I believe that although these numbers aren't as consistently reported, each of the KPIs that Dr. Nelson, and please Dr. Nelson jump in and correct me, but each of those KPIs that we're looking at, they're not reported on consistent, they're all coming from different reporting agencies. And so sometimes we'll get a monthly update, sometimes it may be quarterly, sometimes it may be weekly. So I think it's fair to say that we could touch base on these now that we'll be moving these to monthly meetings, at least to give you a refresher on some of them. Now, if the needle hasn't moved or we haven't been able to get data for certain of those KPIs, they may still be the same, and we can still report out that that's the case. But I think at the very least, being able to check in regularly, because we do expect to see some change month to month on those things. And I think that's the best way we can start tracking whether or not some of the programs that Susan will be talking about later, are they moving the needles in some way or another? Our recruitment and job training efforts, are those moving the needle, and what we can do to kind of pivot on those things? As we all know, with this COVID lifestyle pandemic that we're bringing in right now, planning is one thing, and it's an important piece to do. But to use an analogy, it's like a whitewater raft. We've jumped in that river. You're on the raft now, and we're kind of at the whim of the current as much as anything else. So we're just trying to stay afloat. And so being able to pivot and adjust and survive and last through this is an important part of things. So Dr. Nelson, also.
I totally agree. Some of the numbers come out bi-weekly, some of them come out monthly, and some of them come out bi-monthly. And it's a matter of looking at where we are and what the trend is telling us, and then making adjustments as we go along. But primarily what we want to do is keep as Geoff used the whitewater rafting analogy, keep stroking. And hopefully when we get to the end, we won't be facing another rapid, but we'll face smooth waters.
Thank you both for that. We've gone from Game of Thrones to whitewater rafting.
Susan, I'm sorry. I went to questions before we gave you an opportunity to speak. So.
Yeah, no, that's fine. That's fine. I wanted to comment on some of what, add on to what Geoff and Anthony were saying, because we see that the numbers are rebounding. I want to, of course, talk about hospitality and leisure. And if you look specifically in that data at what's happening around those, hospitality and leisure small business revenue are down 36% from January. And I want to point out that January is not a strong month for hospitality and leisure. We really need to be thinking about what it was like a year ago, where we're really seeing a huge decline. Employment for low-wage workers is down 36% in Durham. That was one of the other charts. And many of those are working in hospitality. So we know that this is a segment that has been hit harder than any other segment, and that's true in Durham, in North Carolina, and nationally. We're seeing hotel room stays are down more than 45% versus a year ago. And we're seeing that the growth has plateaued. It really has not moved much in the last 2 months. And this time of year, much of Durham's hospitality economy is driven by sports, festivals, concerts, conferences, entertainment, and homecoming. And none of those are happening right now. So I think that it is very important that we as a society support and provide assistance to people who are struggling to find food and housing. But I also think it's very important that we help people work. And I am a believer in all that we're doing to keep people safe, and I appreciate that Durham is being very thoughtful and focused on this, and we've done a great job. But we also should be working on helping our small businesses survive, so that we can help people earn a living. So we'll talk in a minute about those proposals specifically, but we put forward some proposals around economic recovery that help get businesses functioning safely, and specifically focusing not just on how do we get everybody back to work, but really how do we do that in some safe and creative ways and help mitigate the risk. So I just want to add that in, that there's a segment of our population that is particularly suffering, and it would be great to look at how we can give them some support.
Great. Thank you.
My soapbox.
So I think this is a good segue because, we've heard the numbers and, between the pandemic itself, the economic crisis, everything else going on in the world around us, the strain that is taking and the toll that's taking on people, certainly it does have a mental health toll as well. And it creates it's significant stressors. And so I am really, I think many of us on this line know Ann Oshel already, but I'm really pleased to introduce her for those of you who do not know. Ann is a senior vice president with Alliance. She leads their community health and well-being, and has been head of that community engagement since 2012, and is very actively engaged in our Vulnerable Populations Roundtable, and is going to give us an update and overview on behavioral health in Durham. So Ann, welcome. Thank you.
Thank you for having me. I've worked in Durham for over 15 years and have always appreciated the community support, and especially the local government support of all things behavioral health. And I tried really hard to put some of the good news in our discussion today, but there's also a lot of troubling things to talk about. So I am going to try to share my screen, and this is about as technologically savvy as I get. So, there we go. So, want to talk first about kind of nationally what we're seeing with some of the behavioral health trends, and and COVID. It's now being referred to as the third wave of the pandemic. And so we had the health crisis, we had the economic crisis, and now we are entering into the mental health and addiction crisis of COVID. And our prediction and projections of all the trends that we're beginning to see is that even as we begin some economic recovery, and when Rod announces that COVID is under control and we all run out to the streets and throw our masks up like a graduation and hug each other, we'll have more than 1 in 4 of our neighbors who are so unwell that they don't see the joy and hope in that moment. And so some of this is just kind of talking about how bad it is now, but how worse it could become. In September of 2020, just last month, JAMA, which is one of the prestigious journals of medicine, reported that depressive symptoms have tripled since the beginning of the pandemic to almost 1 in 4 individuals. That's really pertinent to us. Anxiety disorders are the most common mental health condition in America. We live in a very stressful society. Even without COVID, it is a very stressful society. We pay particular attention to the levels of depression because unlike anxiety, which is largely the hallmark of stress and worry, depression is about sadness and hopelessness and no longer having kind of the emotional energy to even function in life. It is also the #1 predictor of suicide. And so as we looked at almost 25% of people with that number increasing are saying directly as a result of COVID that they are having clinically significant levels of depression, is something that we are following closely, and I'll talk in a minute about some of our efforts at Alliance. Equally troubling, and and why we think that the reported depression is kind of an early projection of where suicide might end up, is that in June, and of course June was really at the height of COVID, when death rates were spiraling and we were starting to see kind of the economic collapse. And at that time, the CDC did a survey and found that almost 11% of adults over the age of 18 reported seriously considering suicide in the last 30 days, compared to 4.3 in the last 12 months. And so we're looking at numbers that are almost doubling at this point. And for us, seriously considering suicide means that you're thinking about it more often and you have the beginnings of a plan. This is not just a fleeting thought of, things are so bad that I don't know how I'm going to go on. This is somebody saying, I've given it enough thought that I know how I would complete suicide. Interestingly, and not surprising, the highest numbers reported were amongst 18 to 24-year-olds. Almost 30% of those surveyed were young people. Unpaid caregivers, and this is a new kind of category in a lot of our surveys, is essential workers. The stress and the strain and the fear of people who have had to continue to work during the pandemic cannot be underestimated. And then our African American and Latino populations. So we kind of take a look at the national landscape and say, so what's happening in the areas that Alliance serves? And we're responsible for the Medicaid and uninsured population with mental health, substance use, and developmental disabilities in Wake, Durham, Johnston, and Cumberland counties. And so this is across our 4 county areas. I'll talk about Durham specifically in a minute, but kind of contrary to some of what we're seeing across the country. And there's always, we're always paying attention to anxiety and opioid dependence. And those numbers are always higher than people who actually come to get treatment. And that's been true during COVID and more true during COVID, that just because people are really experiencing clinically significant symptoms does not always compel and motivate them to make a call to get in touch with a treatment provider. So our overall call volume has been down compared to this time last year. And that's been a trend that has been throughout the COVID for us, beginning in really in March. And so this is where it's a little counterintuitive that you everybody knows somebody who's been affected by COVID from, I'm afraid I'm going to be sick, to I'm sick, to I've lost a loved one. And you would think that we would be seeing a lot more calls requesting help. And we began in January tracking the number of calls to our call center that included some COVID assistance. And we've had 591 calls. In each month, that number has declined. And it's not because we think things are getting better. It's just because I think people are now so exhausted from dealing with it that it's just harder now than it was before. And so again, this is not to be unexpected. I've worked in disaster mental health for many years. Hurricanes, floods, tornadoes, gas explosions, and we always, there are the principles of disaster mental health response. And one of those first disasters is that people can't begin focusing on their emotional health until they think that the event is over. And so a hurricane comes, we know it's coming, everybody prepares, it's over, there's an aftermath, there we are. COVID is, of course, different. I mean, it is like the event that just won't go away. Every time Director Sprayberry comes on TV and says, we're in day 2054 of, emergency operations, I'm like, that is not how it's supposed to be. We just cannot have this prolonged psychological response waiting for it to be over, however we define that, before people can really start turning the corner and allowing themselves kind of the space and the energy to start dealing with how this has affected them. So people are very much in survival mode. They're trying to figure out how to pay their rent. They're trying to make sure that their kids can still get some type of education. They're trying to figure out how to take care of loved ones, and especially if there are aging parents. I have a mother, and I've duct taped her in her house. And so it's, there are lots of things to just kind of, I'm just trying to get through the hour. I'm just trying to get through the day. And, I think the other thing that the challenge that COVID has presented us is that access and comfort level with telehealth is a huge challenge, especially for our vulnerable population. 85% of the Medicaid population has access to a smartphone. What they don't have is a data plan sufficient enough to have all their appointments virtual. And I'll talk in a minute about how we addressed that. And, one of the things that we continue to see, and we work closely with our friends at Duke and other emergency departments, is people are now much more likely to access the EDs with COVID fears and anxiety than calling us. And so we're kind of back to where we've really tried to work hard at, and that's diverting from the emergency department for behavioral health. And so despite kind of how challenging it was for us to turn our whole service system on a dime to telehealth, we have served over 9,700 individuals have received at least one telehealth service from us since March. And, I remember just, the most intensive of meetings at 10 o'clock at night, trying to figure out how do we get our methadone clinics to be virtual. People show up every day for a methadone dosing. How does that happen now? All of our residential sites, from congregate care settings to child and adolescent settings, I mean, a significant majority of them were experiencing outbreaks, some to the point that we actually had to move kids to another facility. We have people in substance abuse treatment who go every single day. How do you begin to replace that? People with developmental disabilities that go to sheltered workshops for job training. How do you replace that? And there is no replacing that. But what can we start putting in place? And then we have all of our drop-in centers where people go, again, every single day to receive some type of help and support. It also allows us to be able to monitor and observe how people are doing. And especially those on the autism spectrum disorder who function through structure and predictability. And so we just started seeing kind of all of these crisis and fires start popping up just because we could not scramble fast enough to get every service that we offered in some capacity of telehealth. That has improved over time, But there for a couple of months, that was probably the most worrisome, challenging thing that we faced. So what we're also seeing that's a little indicative of where we are is that we operate a facility-based crisis center. We have a whole crisis safety net that we are mandated to provide. And there's several components of that, of our crisis system. We have a 23-hour evaluation and observation component where people can come for a period of time and then they can be discharged with a safety plan. We have our behavioral health urgent care. It operates similar to an urgent care. You go there if you have an immediate need. We do a lot of bridge meds, a lot of nursing there. And then we have our inpatient crisis center and detox. And so in quarter 4 for us in last fiscal year, which is the most kind of recent data that we had scrubbed enough to share. And again, this is in April, May, and June. We saw a 26% decrease in the number of persons in our inpatient and detox facilities. We only served, and I don't want to say only, but we had admitted 65 persons during that time. And of course, then it was at the height of the stay-at-home order. So people were very afraid of coming out anywhere. They tried to manage their best at home. And one of the things that had impacted us most for several months, and is starting to slightly get better, but not to the extent that we want, is that our law enforcement partners who had typically brought all involuntary commitments and voluntary commitments to our crisis center started bringing people to the emergency departments instead. And about 80% of the people that we serve in our facility-based crisis and detox centers are brought in by law enforcement or EMS. And so when they started kind of taking to other drop-off sites, that had a big impact on the number of people that we were seeing that were inpatient. But we are seeing people stay a little bit longer. And for us, what that indicates is that while fewer people are accessing our crisis facilities, by the time they do get there, they are so acute in what they need that they need to stay longer for medication stabilization and some other things. We are also, not surprisingly, I know you can't have a conversation related to COVID without talking about people who are precariously housed or homeless. That has been one of the biggest challenges of people that are coming into our crisis facilities and our detox centers that have lost their housing or on the verge of that. We also saw a 12% decrease in our 23-hour crisis evaluation and observation chairs. We admitted 184 persons there. That's really low for us. We served 80 people at our behavioral health urgent care. That was significantly down from 132 and 161 respectively in previous quarters. Here's the other thing to pay attention to that is a trend that we've seen. Really, I was looking at some of our September numbers. It has held true and is going up. 55% of the people that we're seeing are uninsured. And so that's another big access to care issue in terms of people who are already just struggling financially that are now thinking, I can't, why go see a doctor? I can't afford my medicine. I can't afford to pay for that service. And so what we're starting to see is people who are accessing services in an episodic way. They're hitting the emergency department. We don't see them again. They're hitting urgent care. We don't see them again until it gets really, really bad. And then we're seeing them again. And so to kind of offset some of that, like everybody else, we've had an influx of CARES money, which is a blessing. And yet, at the same time, I think a lot of our conversations with our partners in Durham is everybody's getting a lot of money. Sometimes, money that we're just not sure kind of what problem do we need to try to solve with all of this money. And then I have money, health department has money, Pilar has money, the city, everybody's got their own pot of money and nobody's coordinating how that money is spent for a shared population. And I'll talk about that again in a minute, because I think that is becoming really relevant in terms of how we might turn the corner on really kind of impacting some of the systemic issues that COVID is presenting. But we have invested so far almost $20 million. And this is not an exhaustive list by far. We have a breakdown of all of our different kind of payment strategies, I'm happy to send that out if anybody's interested. The biggest amount of money we've had is our financial stability payments to providers. We range from very small nonprofits who are specialized boutique services for us to our largest outpatient provider, which is Duke. And at one time, we had almost a third of our nonprofit providers on the verge of going out of business. Clearly, we could not allow that to happen. And so we've done 2 rounds of financial stability payments to providers. We've expanded our inpatient capacity to relieve the burden on emergency departments. We've established telehealth, including the purchase of phones and data plans for our members who are receiving the most intensive services. So again, those are the people that we serve that need to check in every day on methadone, that need to check in every day on substance use services, that are part of ACT teams, community support teams, whose lifeline is us being able to see them multiple times a week. And so we invested money in making sure that people had access to phones and data plans. And we did that right at the time that everybody was trying to get phones and data plans. And so, it was like our PPE. It was really hard to get enough phones and data plans when everybody else was trying to do the same thing. One of the kind of biggest things that we did is expand our capacity for substance use treatment programs. We had several of our substance use residential programs have an outbreak. And they had to close those programs down for significant amounts of time. Not only did we have to relocate people, but we had more people trying to access that service that really needed a residential setting. And so we opened up 2 kind of temporary locations for an overflow of, and our residential treatment programs are just like shelters. I mean, they were going to be bound by CDC guidelines in terms of social distancing. So the capacity was less at a time that we were seeing more people need that service. We established rate increases for key services. As an example of that, our ACT and our community support teams, which are 2 of our most intensive teams for people with severe and persistent mental illness. We included a rate increase contingent upon those providers addressing food insecurity and homelessness. So you earn that rate increase for us, the better job that you do of successfully housing somebody. Trying to use some of those incentives to begin addressing social drivers. And then we expanded intensive services for persons who are uninsured. I could talk for the rest of the time and I'll spare you. Medicaid is an entitlement. State funded services are not. We have seen consecutive decreases in our state funds for years now. North Carolina has the dubious honor of being one of the only states that have consecutively decreased money out for people that are uninsured when they did not expand Medicaid. And so that has been a huge hardship. We have waiting lists for every service that we have for somebody that's uninsured. Because we're seeing the influx of people hitting our crisis services without insurance, we've now lifted the freeze of all of our services for people and expanded that capacity. So specifically in Durham, we've provided telehealth services when the shelter was relocated to the Marriott. We have covered medication copays for uninsured persons. We have a contract with Gurley's. Gurley's was kind enough to actually begin delivery of meds for people who could not come out or were afraid to come out. We continue to cover the copays for every person to ensure that they stay on all their medications. We've provided food delivery to persons in all of our supported housing programs to alleviate food insecurity. Which was, there was a time that it was hard for people to ride the buses. And the majority of people in our supported housing programs depend on public transportation to get anywhere. So we've done food delivery from the very beginning to everybody in our supported housing programs. We offered the Durham Crisis Response Center access to hotel space for persons fleeing domestic violence. We opened up 3 hotels on our own because there was, there are the people that are homeless by our homeless service standards, and then there are the people that are homeless that are served by our system. And those systems don't always kind of work enough together that people could access the hotels. And so we operated 3 of our hotels. We opened the first one on March the 22nd. We just closed the last one. And so we offered the Crisis Response Center some overflow to that hotel space. In kind of partnership with the county, we have an 8-unit bridge housing program at Carolina Duke. Again, kind of all of our efforts to have people not live, especially in unsheltered homelessness. And so we have 8 units there. We opened that on August the 10th. A week later, we're full with a waiting list. I could seriously have 20 units at Carolina Duke and be full. And we offer case management and peer support services on site. And so kind of at the, in partnership and at the community level, we've developed 3 public service campaigns. The first one that we launched was our just how to deal with COVID and all the things that you're hearing and seeing. I think one of the one of those moments in time that we saw some of the biggest increases in people calling our community department asking for help was in kind of New York City when they started showing on the news, and you could not turn on the TV without seeing these images of bringing refrigerated trailers for bodies. And so we released several campaigns related to grief and loss and dealing with anxiety. We've done suicide prevention, and we continue to do everything that we can on helping people access community resources. There's so many wonderful things that are popping up. We just want to make sure people know how to get connected to that. We've distributed over 8,500 children's masks. 2,000 of those masks went to Durham Public Health Department as part of their community outreach efforts. We've distributed over 16,000 COVID children's coloring books. If you have not met Joey the kangaroo, I am happy to send you digital files. It is a wonderful coloring book. It's in English and Spanish. It is intended to have parents and caretakers, child care centers, alongside children to explain kind of what's happening in this world. We hosted a youth summit. And of course, this was all virtual, but we had 100 kids Zoom in to our youth summit. And we just talked about everything from, how are you doing? What are you seeing on social media? There was a time during that summit where some of the kids were making statements concerning enough to us that we created a breakout room in Zoom and had clinicians there to do suicide screenings. And we've offered multiple virtual trainings. We've done everything that we would have done in person, we now have the ability to do virtually. We're implementing our Hope for NC Crisis Counselor Program. This is a FEMA-funded program. We've had it after Hurricanes Matthew and Florence. It is now, we've added a community outreach component in our vulnerable neighborhoods, which should start in the next couple of weeks. We're very grateful to the Durham Housing Authority. They've been good to us all along. For the last couple of years, we've had additional mainstream vouchers, which are Section 8 vouchers for people with disabilities. And we got some additional mainstream vouchers. It wasn't many, but we filled all those vouchers in less than a week. And then, of course, our ongoing partnership with Duke and the Homeless Care Transition Team to improve access to supportive services and housing. We've tried to be involved in every aspect from, isolation and quarantine to how people go back home. And then we continue to operate 4 of our permanent supportive housing programs. They've been open the whole time. Everything that we can do to get people from one of the Duke outpatient clinics or Duke Health and Housing Program, into housing. And interestingly, over 40% of our admissions to Coming Home, which is our justice-involved permanent supportive housing program, have been in the last 6 months. And so as our jails and prisons have begun releasing people, we have seen an increase in the number of people that we have housed through that program. Also with that program, and in better times, I would have been able to tell you that 100% of the people that we had come into that program were gainfully employed. Within 2 months of COVID, 77% of the people in that program had lost their jobs. And so we've continued to financially support them until they can get on their feet again. And so kind of last, and I know I've gone through a lot of information in a little bit of time, because I wanted to leave time for discussion and questions. But I think my kind of takeaway message is that we should all be concerned about what is happening. And this is not just kind of about Alliance sharing thousands and thousands of flyers and our 1-800 number and our Hope for NC number. I think about kind of two opportunities that if nothing else came out of this COVID crisis, these are two things that it has taught us that if we really began to focus on it, we're going to leave better off than where we started. And one of those is that, COVID has hit us up the side of the head time and time again with the impact of health disparities. And we know that, we've always known that. We try to do the best we can to put a Band-Aid on a gunshot wound, but now it is, you just can no longer ignore what happens when people can't access healthcare. And so an example of something that we think that is an opportunity to take a crisis into something better is health and housing housing is a healthcare strategy. There's no mistake about it. I mean, before COVID, we had national research showing that for people who are high users of public services, if you house them and wrap them around with needed healthcare services, you were going to see a return on your investment and you were going to reduce human suffering. And I think there are so many examples of what we could do with all the funding streams that are now going into the homeless system, the housing system, and the healthcare system to really pilot some innovative models around health and housing. And I would kind of strongly encourage all of the kind of smartest people that I know in Durham to sit around the table and think about what's possible. We're going into our 4th year of operating a partnership with some of the Duke outpatient clinics, who are large feeder sources of the emergency department serving people who are homeless. We are getting some undeniable outcomes, including a 77% reduction in emergency department visits. And that's because we house somebody and we do wraparound services. So I would really hope that we could take advantage of looking at some of those programs, looking at what some other communities are doing, and integrate health and housing more so than what we are now. The other thing that, to think about is, we have the 3 W's ingrained in our head. I mean, everybody can recite the 3 W's. And I am one of those people that if I go to Target and Harris Teeter, I'll say, excuse me, can you go take a few steps forward and stand on your sticker, please? I have totally reverted to my kindergarten mentality. Everybody has a sticker. You stay on your sticker, I stay on my sticker, everybody stay on their sticker, please. And, because we are so mindful of 6 feet apart, wearing a mask, hand hygiene, which is important to control the spread. And of course, we know that there is a price to pay for that. And that is, we just lose all kinds of social connectedness, the isolation that we have for people that you just cannot replace. And all of the disaster work that I do, when we're out there, literally standing next to somebody who has lost their house in a flood, and we're, what do you need? How are you doing? And at the end of it, say, can I give you a hug? That COVID has taken that away from people. We can't even offer that kind of comfort and reassurance to people who are in pain. And so the other thing that we would like to consider is that there be a really broad community campaign similar to the 3 W's around taking care of yourself. We're still at the point where prevention and early intervention will set the stage for where we are 6 months and 12 months now in Durham in terms of people's mental health, and ability to get back to life and get back to work and get back to being part of the community. And so another one of our really strong recommendations is that we consider, again, a community-wide campaign around mental health and mental well-being, similar to what we've done with the 3 W's. So I'm going to stop there. I have no idea if I have taken all my time or where we are, Katie and Phil, but I'm happy to take questions or if there's any discussion. I know this was a lot of information to digest.
This is terrific. Thank you so much. It is a lot to digest, but it's so important and so vital to the discussion that we're having and the work that we're doing. So happy to open it up for questions. We probably have about 7 to 10 minutes for any questions.
So this is Lois. Thank you so much, Anne. This is terrific. I mean, where to start because it's such a weighty and huge topic. I've been particularly concerned about the elderly who are more isolated than ever, particularly those who typically, go to the senior center and places like that as an outlet. I've also been particularly concerned about special needs individuals, like folks who would typically go to Threshold or do Special Olympics. Do you have any information to share around what's happening, particularly for to support the elderly who are isolated, as well as special needs individuals, again, folks who would typically go to residential places during the day, like Threshold?
Yes, so that's an excellent question. Threshold, Wellness City, all of our, structured day programs for people are operational with limited capacity virtually. And as I mentioned before, that is no replacement for people being able to come someplace every day and be surrounded by caring, encouraging others. So we're doing the best that we can with that. We've maintained kind of financial capacity for all of those providers to continue to see people. We are slowly starting to do some outreach. Even in the midst of this, we did move 5 people out of group homes into their own housing. And I guess that was probably one of the other things and this is a similar theme, but we've increased the amount of financial assistance that we provide. We've always had a program called Independent Living Initiative, which is an eviction prevention rapid rehousing program for people that we serve. We've increased that money this year, and we are on track to be out of money by January. We just cannot. I mean, it is unbelievable, the number of people. And so to your point, Lois, we are prioritizing as best we can, and that means making some really hard decisions at time. But if we're having to decide between paying the rent of somebody that's 65 and paying the rent of somebody that's 27, we're going to pay the rent for somebody that's 65. And we're getting ready to launch a campaign specifically for older adults. We have marketed the Hope for NC line a lot in our senior centers, our meat packaging industries, childcare, anywhere that there's essential workers. We've really tried to promote that there's some outreach, but there's no replacing what typically happens.
A quick follow-up there, and that is for parents, particularly those of school-age children. I hear a lot from my younger friends who are not accustomed, to having children at home all day long, and they are working, and everybody is stressed. What's being done, to your knowledge, to support? And I know some people are accessing services through their medical providers and all of that. But are there particular efforts that you know of to support parents?
So we offer training to parents. It's, again, one of those things that we'll keep offering it and hope that people kind of get into kind of the space where they have time and energy to begin looking at that. But we have offered a number of trainings for parents around how to manage virtual learning, especially if you're still working. And those are 30 minutes or an hour with that. One of the things that we're actually doing in one of our other counties that I'd like to talk to Dr. Mabenga about is that there is a list of students who have a certain number of absences during virtual learning. And so for us to be able to do some community outreach in those zip codes and neighborhoods where we know students are not attending schools, and we could just go and check on kind of why that is, we're hoping that we can work out a way to do that. This is one of those things where it's the absolute right thing to do. And then, HIPAA and FERPA prevents a lot of the right things from happening in terms of being able to share information. But our hope is that if they even give us aggregate level data of particular neighborhoods or zip codes, we could begin to knock on doors. And I think until some of this is just really contingent on schools being able to kind of figure out where they are.
Katie, can I jump in?
Please.
Thank you so much, Anne. And as Lois said, you've given us a lot to think about, and are thinking about your challenge to all of us of having a focus on, self-care as being another part of the message that we give out to everyone. I know we won't have time to really delve into that fully with the time that we have left here, but I'm thinking about that challenge and just wondering what your thoughts are about how we go about it, and whether that's something that you feel like Alliance could lead the charge on, because certainly, for instance, Durham County, and Rod can talk on this, we have a digital kind of wellness campaign right now where we actually have somebody on staff who's doing a great job about mindfulness and self-care. But how do we then push this out to the broader community, and who can really lead it? We do have a lot of opportunities. I mean, I'm thinking about even our faith community roundtable with Dr. Davis, his thoughts about this and the vulnerable communities. But I feel this is something that we can do for sure. And, last night I happened to be phone banking for the election and really had about a half a dozen very long phone calls with seniors. And just getting at the point that you said, Lois, I felt like I ended up getting into these long conversations because these people just wanted to talk to somebody. And so, there's still, even if we can't do it in person, I feel like there's still a lot that we really can do, and that we do have the networks, thinking of Partnership for Healthy Durham, Partnership for Seniors, Yo Durham. We have the structures in Durham, our churches, and other synagogues, where we could really focus on this, taking care of each other, even with whatever way we have. So just wanted to get your thoughts on next steps on that, and whether you feel like Alliance can help lead that.
We would be happy to help lead that. We would want to lead that. And I think it's, as a starting point to have kind of all of our stakeholders, partners who would want to be part of this, just to identify somebody from communications and information to sit with us. We'll coordinate a meeting. We'll think about a messaging. I mean, we can do everything from public service announcements, you can't go in a store without being reminded of the 3 W's. So if you go into a business, a church, synagogue, wherever, and be reminded of all the ways to take care of yourself during this. So from print campaigns to public service announcements, we could look at everything, and we have the funding to really help with that. So if whoever is interested that could identify somebody from communications, we're happy to kind of schedule next steps in a meeting.
Great. Well, we will definitely, I'll look to Katie and Maticia, Ryan, to help with the follow-up on that. Thank you.
Terrific. Definitely follow up. And I'll get you the names of our folks at Duke to connect on that. Any other questions for Anne? Well, Anne, I just want to thank you so much. Thanks for all that you and Alliance have been doing. The work is tremendous and tremendously important. So thank you very much. And
well, thank you for taking the time to hear a little bit more about what's happening on this end, because it certainly does, it aligns with everything else and the efforts of everybody to come out better than where we started on this, I think is just commendable.
Great.
Thank you.
I'm going to turn it back over to Maticia to help guide us through the discussion of the number of proposals that we've received. We've received 7 proposals. 5 of them, I think, came in this week. So, Maticia?
Yeah, thank you, Katie. So thanks to the subcommittee who met on this past Wednesday, I guess that was 2 days ago, to review the 7. And like Katie said, 2 had been submitted before, and there are 5 new proposals that we reviewed. Hopefully everyone's had an opportunity to read through the proposals. I think we all recognize on the subcommittee that every proposal that we get, they're great ideas, but we also recognize that we have limited funds that we have access to. So we really have to look really hard at the proposals and bring forth to you something that we think meets the scoring criteria that we've laid out. And the scoring criteria that we use, there's 5 items that we score on, and these proposals can score anywhere from 5 to 20. And so based on that scoring criteria, we had 3 that actually scored very high. So we started with those 3. And the 3 that scored really high were Proposal 1, pulse oximetry, Proposal 2, which I think is system and testing support, and Proposal 7, which was green light Durham. So we focused our efforts on those 3 initially. And after much discussion on those proposals, the subcommittee is recommending to the task force that we move forward with proposal number 2, which is the system and testing support for the food industry. That current proposal is requesting funds of approximately $45,000, and that proposal will provide COVID-19 support and testing for downtown small businesses for about 18 weeks. So I really want to pause there to see if there's any questions about that particular proposal before we talk about the remaining 6 that we also discussed during our meeting. So any questions or comments on that particular proposal? All right, so not hearing none. So for the other 2 that scored really high, pulse oximetry and Proposal 7, green light Durham, we decided that we needed some additional follow-up for those proposals before we move them forward. So there's continued work on those 2 proposals. So we'll keep working on those until we feel like, we have something that we're ready to bring forward to the task force. Proposals 3 and 4, those are the proposals related to festivals and Durham Delivers. Those proposals scored around the mid-range for us. We had a lot of discussions, determined that we do need to do some additional follow-up on those proposals. And we also had Anna Davis, who supports the task force, take a look at all the proposals, and she actually provided us some feedback on proposals 3 and 4. So I'm gonna turn it over to Anna to talk to us a little bit about proposals 3 and 4.
Sure, happy to. Good to be with everyone this morning. So when you're thinking about allocating public funds, you have to really be careful to make sure that the funds that are being used forward a public purpose. They have to be used in a way that impacts a community or a wider range of residents than just specific individuals or specific types of industries. It needs to have a broader impact. And so there has been a little bit of flexibility in that with CARES Act funding, but you still need to make sure that any use of federal or state funds is really beyond reproach. One area that is without question forwards a public purpose is these public health measures that impact the entire community. So using number 2 as an example with the testing for food industry, that does benefit in a way a specific industry, but that benefits our entire community. You want people to be able to go to restaurants, which helps the economy, and people to know that they can do so safely. So it benefits everybody. What concerns me a little bit about number 4, Durham Delivers, is that it is the ordering food from a restaurant, dining out, that is sort of a luxury. Not everyone in our community has the ability to do that. We certainly, with loss of jobs, with the situation that we're in, it really is something that only possibly more affluent residents can do. And so having something like a meal delivery service that is using public funds, it's harder for me, based on the case law that I've read and the School of Government guidance on this, to see the connection that benefits the entire community. It would be different if the meal delivery service was not for private individuals who can afford to do so, but for seniors like we're talking about. I mean, if this was some sort of system where the people benefiting from it were needy in some way or vulnerable in some way, I think it could be justified. So that's my concern about that particular proposal. And similarly, the same sort of framework for the next one, which I think mentioned gift baskets for specific people. It's I think harder to create a case that benefits our entire community. So those are sort of my thoughts about that. I'm happy to take questions and provide a more detailed analysis if people would like to see that.
Any questions for Anna? Anna, thanks for that update. I appreciate you taking a look at the proposals that were submitted.
Yes, ma'am.
Maticia, I have a question for the group. So I know that our subcommittee did think that Durham Delivers had some promise, and based on Anna's counsel, it seems like it may not be a good fit for public funds. But I wonder how this task force might think about promising ideas that emerge that aren't good fits for public funds, but perhaps could be for, maybe there are other sources of funding that we might think about pursuing that are outside of public funds, and what role this task force could envision in that. And this could be an example of something to think through in that way. So I just wanted to pose that question.
That's a great question, Ryan, and certainly want to hear from folks about their thoughts on that.
Well, I have some thoughts about it. Yeah, we've got to figure out a way to do this. It's crucial. And if we are, if public funds aren't available for it, then we've got to figure out how to get the private funds together. I don't think there's any question about that. So I'm happy to help with that, and we need a strategy if that's what we're going to do. But we can't let this languish.
It does seem like, based on that criteria, that it would be difficult to fund in specific economic development programs designed to help lift the businesses, because they're going to tend to be specific to particular businesses that are poised to take advantage of it. And of course, there's the obvious piece about while it takes income to order food from restaurants, the people who work in the restaurants are suffering because of the lack of orders. So, but I recognize that's not really in your control, the definitions of those things, but it is unfortunate.
Yeah, the Durham Delivers is an interesting one because part of the proposal, so 50,000 was really for coordination, and then 70,000 was more around the development of this app, which feels like under different circumstances would have been ripe for sort of some type of investment and finding private investment. But I know these are difficult times, but it does seem like that one in particular, there might be interest somewhere in the community in investing in that. I don't know how that would work.
Yeah, the other thing I'd like to point out that I don't think was evident as we filled out the templates. I don't think it really stands out, is in each one of these, I'm a business person and I don't want to invest in something if it's not going to deliver results and response. And it's in these times, it is so difficult for us to predict what kind of response. So each one of these proposals around helping businesses recover can be done incrementally. We may put on there an amount to hire a contractor for a year, but the fact is we try it out. And if it doesn't work after 2 months, then we can stop and we'll look for other things or refine the program. And each one of these allows for that. I think when you think about public funding, it may be difficult to think about incremental funding. I know that there are processes to have to go through every time you want to come back for more funding. If there's some way to go after private funding, that may be a helpful part of the conversation. But there's still the question about who is it that we would look to help fund some of these things.
I have a question for Anna. I guess I'm a little bit confused about what you're saying, because can you explain to me how this is different than, for instance, the small business program that we're doing, where we're doing loans to businesses? Because I guess I just see this as a different way to support businesses, because again, the end result is keeping those businesses, as Anthony spoke about last week, that one of the most important things we need to do right now is to support our small businesses, because they are the biggest employers in Durham. And so if the goal of these programs is to keep people in business, I don't understand how that's not a public benefit, because they are employing people locally, and because they generate the tax revenue that then provides the funding for city and county services and programs. So I'm actually really having trouble with understanding the thinking around this. And I think also what we heard last week on our presentation is that throwing money directly at businesses is not necessarily the best way to help them, because they then have to pay back the loans. And so that we need to find other ways to provide support to keep these businesses going. So could you, I just would like to understand better what your thinking is related to that.
Keeping people working is critical right now. I think what is a little bit different about this proposal is it puts the city in the business of creating and funding a business that is in direct competition with other businesses that are already operating. I understand that the fees are high for DoorDash or Uber Eats or those types of businesses, but those businesses are employing our local residents as well. And so it puts the government in the position of creating a project that is in direct competition with businesses that already exist. That's what's a little bit different about it specifically. And then, just again, going back to the connection that this will, I think Susan said there might even be some hesitation of private investment in a project like this right now. Maybe there's not an appetite for it, or there isn't the funding. That makes it even more tenuous to show that it will serve the public purpose that funds have to serve.
But Anna, can I
will say that, sorry, I was going to say one difference between Durham Delivers and the apps, corporate apps, is that this is strictly a bulk delivery program. So it technically does not compete in the sense that DoorDash and Uber Eats and all of Grubhub are individual orders. So it does operate differently. And of course, there's the point that no one's making any money off of this other than the restaurants. I mean, it is not a business competing. It is just a service that's being funded.
I was wondering, Anna, in terms of the other proposals, because there are a number of proposals here that are designed to help with the economic recovery, to help keep businesses in business so that we can keep people employed, so that we don't have further evictions and that. So if you looked at the festivals and events support or the co-op proposal, are those similar in your mind?
Actually, I think 3 forwards a public purpose, and I have seen no legal issue with that one. Number 6, I need to do a little bit more research about that one because it relates to advertising, and there have been some CARES Act funding dollars used for advertising. I guess I need to think more about that. I mean, I talked to Commerce about that one particular issue, and you know, the question that came up to me is advertising really the issue right now? Is it that people don't know these businesses exist or are open, or is it that people can't afford to go to these places right now? So that one might be, that one is a maybe to me. But 1, 2, 3, and 7, I think all clearly forward public health and public purposes.
I can give a couple other data points around that Durham co-op proposal. One is that it's modeled after a Visit and See program that's distributing CARES Act funding to destination marketing organizations to do advertising. So there's a huge precedent for, and I assume that would be
there is. I guess my question is whether you know, is it going to use CARES Act money? Do you anticipate that 6 would use CARES Act? If so, that one may be fine, but you have to spend all that money by December 31st. It cannot, it looks like the proposal went into 2021, and
yes,
the CARES Act money has to be, unless Congress changes the law, it's got to be spent by the end of the year.
The CARES Act funding is public funding, right? Is it different in terms of how the rules apply?
It's federal funding, and there are some specific carve-outs in CARES Act funding, which would suggest that there is more flexibility for economic stimulus. That isn't the same with, you know, our tax dollars. So yes, there is some more flexibility to interpret it under the CARES Act. What's unclear to me is whether this is CARES Act funding or not. I'm not sure about that.
Okay, and I don't know that. To the point about whether it's advertising that will help, this gets to, it's about helping them generate revenue.
Right.
I know anecdotally we've talked to small business owners who have said that assistance with marketing and getting the word out would be very much make an impact and would be a welcome relief. And small businesses, when they're in this kind of mode, advertising is the first thing that they cut out. But advertising is proven to work to generate traffic. And that's what we're trying to help them do.
Yeah, so, that one doesn't concern me if it's coming from CARES Act funding. And I've asked that question. I'm unclear about what these funding sources are, and it sort of makes a difference in terms of how you can argue whether something is public or if it's economic stimulus. So.
Okay.
Now, one thought I have is that these are legislative decisions, and you know, we are lucky to have Anna. We get great legal advice, but these are ultimately legislative decisions. And you know, Wendy, speaking to one of the points you raised, it's exactly because of this problem that our programs were loan programs to the small business and not grant programs. It was exactly because of this problem, the same problem that Anna is raising now around the Durham Delivers. That's not inconsistent with that. In fact, it's totally consistent with that decision we made, but it was a decision we made. You know, we get our best legal advice and then we make the decisions that we make. So,
yes.
But I do think that one way or the other, on the Durham Delivers, I really feel like we need to figure out a way to get it funded. So I think we need a group that's going to talk about that. And Susan, I'll be happy to be a member of that group, but that needs to get convened.
And I just want to add, Anna, the point you just made about the CARES Act funding. There just was a decision or an interpretation that came out of the district attorney's office. So I'm sure you know more about this than me, Anna, or there's been some guidance that CARES Act funding can be used for grants, direct grants to businesses. And so I think the point Anna was making, which is important, is that there is flexibility. For instance, the city could choose to use their CARES Act fund money for some type of a stimulus or whatever, or a grant, which I don't think we realized that originally.
Alrighty, so with 4 minutes left on our agenda, so our proposal to the task force is to move forward with proposal number 2. These others that we've talked about, we'll continue to work on the other proposals. We'll continue to have conversations around, how do we creatively get some of these good proposals funded, even if we can't get public funding. So there's still more work for us to be done, for us to do, but we will move forward with recommending that we move forward with proposal 2. And I didn't hear any questions or concerns about that one. So that will be our recommendation from the task force.
Maticia, I have some concern about timeline, given that the group is only meeting, task force is only meeting monthly. Do we want to empower our subcommittee, which has been so effective, to make recommendations to the public bodies absent a meeting of the full task force? Or are we planning to do some sort of online polling of the task force? I think you may have told us that before, but I can't remember the answer.
Yeah, I think what we did, Mayor Schul, before was we met and we sent out an email basically saying, here's the recommendation that we're planning to put forward. And unless we heard someone opposing, we moved ahead with it. And so I would recommend that we continue to do that. So if there's additional work that we need to do outside of when we have a meeting, we can meet as a subcommittee, send out an email to inform if there's concerns. Task force members can raise those concerns. We can address those concerns and keep the process moving, because we certainly don't want to slow down any work that we're trying to get done.
Yeah, I mean, I think about, this proposal Durham delivers. I think about the pulse oximetry. If you all have feeling good about those in 2 weeks and not a month, it would be good to make those move, given that government's pretty slow anyway.
Absolutely. We will keep the process moving.
Thank you.
All righty. Well, with 2 minutes to go, I think we're pretty much out of time, unless someone has something urgent that they want to share with the task force before we dismiss. Yes, Pilar?
Sorry, I think I want to update about the health ambassadors. I think I didn't do it before, but we are moving forward at El Centro. We have 2 people already hired for start next week, and they will be trained by the people at UNC, and we will start working, doing the piloting and everything. So the project is moving forward.
Thanks for that, Pilar.
I'll just mention, if anyone has any questions or follow-up to Ann Oshel's presentation, if you will please get that to, I'm going to volunteer Phil and me before the 20th, or not the 20th, the 1st, yes, the 20th of October. That's our next vulnerable populations work group. Ann is in that, and we can ask those questions there and then follow up with this group. So if you will get them to us by October 20th in the morning, we will then be ready to have additional discussion with her that day.
I know we're, go ahead, Phil.
Just want to quickly recognize a couple Lincoln employees, and this is because of the mayor's earlier question. But we have Dr. Leo T. Barber, who's very special to Lincoln and to the mayor himself. Just celebrated 35 years of service to Lincoln Community Health Center. We also had Faye Banks, who joined us at the same time as Dr. Barber. And we also have one of our dentists who celebrated 40 years, Dr. Slade. So, Mr. Mayor, I just wanted to share that with you, especially in the rest of the task force.
Thank you, Phil. Phil and I met when Dr. Barber, who is my next door neighbor, invited us over to Christmas when Phil had just come to Durham to Christmas lunch one day. And he is indeed a dear friend. And thank you for that, Phil.
Thank you.
All right. Sorry, Maticia, I thought you were dropping off.
Hi, Katie.
All right. Well, thank you all so much. Have a wonderful weekend and appreciate your continued leadership. Take care. Stay safe.
Good weekend.